What do we do with chronic pain in the age of the opioid crisis? I'm Dr. Rueben Brock, and that's what I'll tackle in today's House Call. Hey, before we get started, I want to remind you to subscribe to this channel, leave a like, and don't forget to hit the bell for notifications. So, everybody knows about the opioid crisis and the fact that people are dying from heroin use and prescription drug use is at an all-time high and it's reaching epidemic proportion. But what a lot of people don't think about is the impact of this crisis on the lives of people with chronic pain. So what we have recently seen in the news is some discussion of the fact that the pain management community, the medical doctors, and the use of prescription opiates really did contribute to, and some would argue caused, the opioid crisis. And the reason for that, the way this thing goes, is what happens is a person gets hurt. Let's say they get a back injury at work, and they are prescribed opiates to manage that pain. Okay, and the nature of the way opiates work, you will build a tolerance for those opiates. That's just the nature of the beast. It's going to happen. You will build a tolerance, which means now you need more of that same opiate in order to get the same benefit that you used to get. Naturally, people become addicted. And what happens is that the doctors are having to monitor how much of an opiate that they give someone. And they are monitored by the government, and there's a threshold that you reach where you're not supposed to go over it, or these doctors are considered, doing something wrong, contributing to a problem. And so they are really under strict guidelines about how much they can prescribe. But the nature of these opiates makes it so that a person with chronic back pain from a back surgery, from an injury from 10 years ago, that person will naturally need more and more and more of their opiate in order to get relief from their pain. And when their doctor cuts them off, which will inevitably happen, they now have a choice to make. And oftentimes what happens is the person is going out onto the street and getting more of their prescription than their doctor is willing to give them, because they want to manage their pain, not because they want to be a junkie, not because they mean to be addicted. And when they figure out how expensive it is to buy prescription medicine out on the street, a lot of people, unfortunately, make the switch to heroin because heroin is much cheaper. And so it puts you in an interesting predicament, because if you follow the doctor's advice and use your prescription opiates, so we're talking oxycodone, Opana, Percocet, Tramadol, if you use those prescriptions as directed by your doctor, it is inevitable that you will eventually become addicted to those opiates. But if you don't use them, then the question is, okay, well, what do I do with my pain? And what I'm seeing more and more today is that people who are using medical marijuana are having some relief from their pain, and it is allowing them some degree of distance from their opiates. That gives me a little bit of hope, the idea that you may be able to pull out that opiate and use marijuana instead. Now, you are in that situation trading one drug for another. Right? So there is an addictive quality to marijuana. But in all fairness, I would every day and twice on Sunday choose to have one of my patients, one of my clients be addicted to marijuana if I had to choose between that and an opiate. But also, that addiction is much more manageable than the opiate addiction. But the other thing that I think a lot of people who are in that chronic pain situation ignore or forget is the behavioral aspect to pain management. Whether you want to believe it or not, there is stuff that you can do that will help manage your pain and even reduce your pain. Something that helps me significantly is like aquatherapy. I have chronic pain in my legs, nerve damage, and if I get into a hot tub, it will relieve my pain, at least temporarily. And that temporary relief allows you the difference between needing more of a drug and saying, I think I can hold off for a little longer. And so things like going to your gym, getting in a pool. I have heard people say they feel real relief just from being in the water, and let alone doing any kind of true aquatherapy with a trained professional. So that's something to consider. But also finding the other things that give you relief. There are people who feel real relief from their chronic pain and other body issues from things like yoga or Tai Chi. And some of that might be about the rush of adrenaline that you get when you are engaged in these activities, but also some of those things are restorative in nature and can give you real relief. That again is the difference between you needing a pill right now and you being able to get through these next couple of hours without a pill. There are often times when you are simply trying to figure out how to get through this next couple of hours without the use of a pill, especially if your doctor gave you this many pills and you know if you use an extra pill, you're going to come up short at the end of the month and need more of that medicine, which again is going to be received as drug seeking right now because of the current climate. And so keep in mind the behavioral interventions and even therapy, talking about different things in your life that are stressing you out. Believe it or not, when you are more stressed, you get tense, you will feel pain in your body because of that stress and tension. But in addition to kind of pointing that out, I hope that this conversation gives some pause to those medical doctors out there as they are approaching their patients, thinking about, is this drug seeking? Oftentimes what I realize is a patient that looks like a drug seeker in your MD's office, to me looks like a person in chronic pain and at their wits' end attempting to manage that pain. So something to think about for all of you medical professionals, but also for the politicians. We've got to figure out an answer to this opioid issue because there are people whose lives are truly impacted by it. So that's all I've got for today. Don't forget, subscribe to this channel, leave us a like, and ring the bell for notifications. I'm Dr. Rueben Brock, and this is House Calls.